Hi, my name is Hayley Matthews. My student number is 102-420-121, and I will be talking about a little boy with pediatric asthma. Patient history. Owen is a 3-year-old little boy with a history of acute asthmatic attacks. He had moderate wheezing between the ages of 6 and 36 months, and he has a maternal history of asthma. He has had 5 ED visits since his diagnosis at 6 months, with the last one being 2 months ago. He has had 0 admissions to the hospital from his ED visits. He has a prescription for salbutamol, but does not use a spacer. He last used his inhaler 1 week ago and 2 hours ago, which provided unuseful. He uses his puffer about 2 times per week. However, his symptoms occur about 3 to 5 times per week. Sometimes his symptoms can be managed with no puffer when the trigger is eliminated, for example, stopping physical activity. His symptoms usually occur at night or during physical activity. Both of his parents are non-smokers, and they have a hypoallergenic dog who's 6 years old. He also has an allergy to soy. Current presentation. Owen presented to the emergency department last night at 21:37. He was agitated and cranky. He was unable to speak full sentences, and he was breathing with the use of accessory muscles such as his shoulders and stomach. He also had a dry cough, and his breathing was shallowed and labored. There were also sounds of wheezing present upon auscultation. His heart rate was 149 beats per minute. His respiratory rate was 42 breaths per minute. His SpO2 was 91% on room air, and he weighs 15.3 kilos. His asthma started when he was running around in the backyard with his older sister, who was 7, and his mother reports no recent, sudden, or unexplained weight loss or gain. Pathophysiology. Asthma starts with a source. These sources are called triggers or allergens. These triggers or allergens then cause a cascade of effects in the respiratory system. First, there is an inflammation of the airway. This means that the tubes of the airway swell. Then, secretions are released which block the passages. Bronchial hyperactivity then happens, which leads to bronchospasms, which then leads to bronchoconstriction, the narrowing of the airway. This also leads to a blockage of the airway, and it increases the resistance of the airway. Please see a great graphic from kidshealth.org showing the difference between a healthy airway and an airway that's being affected by asthma.
As you can see in the picture, in the open airway, the bronchioles are able to have air flow through freely. However, in the narrowed airway, the inflammation and the mucus makes the bronchioles constricted, which makes it very difficult for air to flow through them. This is asthma.
All of these issues work together to cause Owen's symptoms of being agitated and cranky, unable to perform proper sentences, wheezing upon auscultation, and the use of accessory muscles during breathing, as well as his dry cough.
Issues and goals.
The first issue is that Owen's airway is inflamed and blocked. This is causing his trouble breathing, resulting in stats that are out of their normal range, including his oxygen level, which is at 91, his heart rate, which is at 149 beats per minute, and his respiratory rate, which is 42 breaths per minute. The goal for this issue is to get Owen's stats back into their normal range. The second issue is that his asthma is currently not controlled. The goal for this issue is to reduce the amount of times that Owen presents to the emergency room in 1 year.
Nursing interventions.
First nursing intervention is to stop the acute asthmatic attack. Putting the patient into Fowler's position is a start. This means that Owen would be sitting straight up at an angle as close to his 90 degrees as possible, with his feet slightly bent. This allows the chest to open up and inhale larger amounts of air. Next, Owen must take his inhaler. This is a fast-acting selective beta blocker which works quickly to relieve the inflammation and open up the airways again. Owen would also benefit from nurse-initiated oxygen. Because Owen's oxygen level is at 91%, he is not flowing enough oxygen through his body. This means that the nurses should provide him with nasal prongs to increase the amounts of oxygen in the blood until he is breathing normally again. Lastly, if none of the other interventions are working, it would be beneficial to speak to a doctor about prescribing a different medication that would help, such as a corticosteroid. The second nursing intervention is to educate the parents on managing and preventing Owen's asthma at home. Parents and healthcare workers must create a collaborative partnership to outline the limitations the child may have in terms of treating their asthma. This collaborative partnership allows the nurse to openly talk to the parents about issues or outcomes that are possible with the management of their child's asthma. This is likely to increase the retention of the information by the parents, and they are more likely to ask questions, be engaged, and be compliant because the nurse is a trustworthy source of true, non-judgmental information. His asthma is currently controlled, and it would be beneficial to Owen if it was controlled. His current symptoms occur about 3 to 5 times per week. He uses his puffer about twice a week, and his symptoms usually occur at night or during physical activity. The parents need to be educated on possible triggers and how to avoid them if possible. These triggers include physical exertion, pollens, and allergens. Owen's parents should monitor him closely and recognize these signs of asthma, such as loss of breath, exhaustion, and coughing. If these signs are recognized early and interventions are put in place, then the likelihood of his asthma progressing into an acute attack is much less likely. With Owen's asthma being more controlled at home, this significantly reduces the risk of an emergency department visit. Nurses can guide parents to websites or provide printed material that they can refer to if they need a refresher or more information. Some of these websites include nationalasthma.org.au, asthma.org.au, and kidshealth.org. Lastly, make sure that they know that nurses are always there to help and that they welcome questions or concerns that parents may have.
Owen is a 3-year-old boy who has a history of acute asthmatic attacks. His current presentation is that he was admitted to the emergency department at 9:37 p.m. He was agitated and cranky. He could not form proper sentences. He had wheezing upon auscultation. He used accessory muscles while breathing. He had a dry cough. His breathing was shallow and labored. He also had stats that were out of their normal range, with his heart rate at 149, respiratory rate at 42, SpO2 levels at 91%, and he was 15.3 kilos. His asthma started when he was running in the backyard with his older sister. The first issue in Owen's case is that his airway is inflamed and blocked, and this is causing his trouble breathing, resulting in stats that are out of their normal range. The goal for this issue is to get Owen's stats back within a normal range. The second issue is that his asthma is currently not controlled. The goal for this issue is to reduce the amount of Owen's emergency department visits in 1 year. The first nursing intervention is to stop the acute attack by putting him into Fowler's position, taking his inhaler, giving him oxygen, and speaking to the doctor about a different medication. The second nursing intervention is to educate the parents on the management and prevention of his asthma at home by working with them and educating them on triggers and medications and providing them with information and websites where they can read more.